health has been defined to refer to your complete physical, emotional, mental, and overall well being. On today's show, we're going to give you some health tips to keep you healthy and, as always, answer your healthcare related questions here on Ask the Doc. No appointment needed.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Hi, and welcome to Ask the Doc, no appointment needed, the show where your questions get answered by our medical experts. My name is Dr. Kamaljit Kaur, and I'm a double board certified primary care physician. This is going to be an exciting show, because we're going to talk about a broad range of health topics. So let's get right to it. Our first question comes to us from Kevin, and Kevin writes in asking, on your previous shows, you talked a lot about gut health, our immune system, and the impact on our overall health. I have diabetes, and I am scared to death I will give it to my daughter. Is diabetes one of the autoimmune diseases that is affected by gut health, or is it hereditary? And if so, is there anything I can do to help my daughter now? Kevin, thank you so much for this question, and it's a really important one. But before I dive a little bit further into it, let's watch this video from our friends at the Mayo Clinic.
Type 2 diabetes is on the rise.
The increased incidence of obesity is what has probably driven part of the increase in diabetes.
Mayo Clinic endocrinologist Dr. Adrian Vela says diabetes happens when your blood sugar's too high. It's a leading cause of blindness and amputations, and it increases your risk of heart disease and kidney failure.
Dealing with high blood sugars early gives you a better chance of spending a longer time not requiring medications or other interventions to control your diabetes.
Some people develop type 2 diabetes even if they're not overweight.
But for others, lifestyle choices such as eating right, exercising, and losing weight can help prevent and even manage the chronic condition.
But unhealthy choices can be dangerous, especially if you have a predisposition for the disease.
Heredity loads the gun while environment pulls the trigger.
But you can control diabetes with proper treatment. For the Mayo Clinic News Network, I'm Vivian Williams.
It's a great video with a lot of good information to introduce the concept and the disease of diabetes. And while some parts of that video might have seemed a little bit scary, I also want to reassure you that if you catch it early and you treat it appropriately, diabetes can be certainly well managed and in some cases even prevented. Now to your question, I assume that when you say autoimmune, you mean diabetes type 1, because diabetes type 2 is generally not caused by autoimmune mechanisms in our body. And in that case, yes, certainly diabetes type 1 and autoimmune diabetes can be affected by our gut microbiome. Now, while there's a genetic component to all of this, there's many factors that will need to come together in order to increase the risk or introduce the development of diabetes in an individual and in your daughter. So there's a lot to think about here, but having a poor gut microbiome can certainly contribute. And that contributes because when you have a poor gut microbiome, it's usually one that induces a lot of inflammation in the gut and also reduces or impairs the immune system of our gut. Now, as I have mentioned in previous episodes, gut health is really important. In fact, some studies have alluded that about 20% of our immune system lives in our gut. So when you have an inflamed gut, you certainly have an impaired immune system. And yes, that can produce autoimmune conditions like diabetes. The other thing that's interesting to know is that people who have poor gut microbiomes have a low count of what are called short chain fatty acids, like butyrate. You might have heard of this. It's been going around social media a lot lately too. Now, studies have shown that individuals with type 1 diabetes specifically have very, very low levels of these short chain fatty acids that are actually really important in maintaining our gut health. Also, having an overabundance of bad microbiome or bad microorganisms in your gut, again, produces that inflammation, but it can also help the body produce the antibodies that attack the pancreas, especially the cells that produce insulin. So yes, your gut health is so important when it comes to preventing and managing and treating diabetes, and most importantly, keeping it from getting so bad that it becomes complicated. Now, I hope all this information helps, and I hope it helps you feel a little bit reassured of what you can do to help your daughter stay healthy and stay away from diabetes, hopefully. Let's get to our next question. This one comes to us from Sheldon, and Sheldon has reached out asking, I wanted to ask about the need to rest between exercises. How important is it? Also, what supplements should we take when we need to recuperate our body and our minds? That is such a great question, Sheldon, because I often get asked, what types of exercises should I do? How often should I do it? What intensity should I use? And all of those specifics, but I rarely get asked, hey, should I be resting between exercises? And if so, how much am I resting? What kind of rest should I be doing? And that's equally, if not more important to your overall fitness and to getting healthy. But unfortunately, the answer to this isn't clear cut, like with a lot of things in medicine, and I apologize for that. There is still research that's going on to really get into the nitty-gritty and get some final answers on this. But the amount of rest that is needed typically depends on the type of exercise you did, how intense you did it, how often you did it, and what is your baseline endurance level. And let's not forget, what are your fitness goals? Are you looking to tone down, trim fat? Are you looking to be like a bodybuilder and build a lot of muscle? All of that really factors in your individual recommendations for how to rest, how often to rest, and how much or how long to rest. Speaking of which, in general, when you're doing resistance training, so things that require you to engage your muscles, weightlifting, usually 1 to 3 minutes of rest is the rule of thumb recommendation. But if you're doing something really complex or really heavy lifting, then you might want to go a little bit longer, 3 to 5 minutes even. Again, this depends on your baseline level of endurance and your fitness goals, but those are some general recommendations. Now, what about aerobic exercises? Say you're on a treadmill and then you want to jump onto the elliptical, or you're doing certain body weight cardiovascular exercises. Before moving on to the next exercise, typically you want to wait about 2 to 4 minutes. Now, I know this sounds like a lot, 1 to 3 minutes, 3 to 5 minutes, 2 to 4 minutes, but it's really important, especially if you're somebody who's just beginning to exercise. Because even though a lot of us are impatient and we just want to do those reps and then get on to the next exercise, we really need to let our body get back to a rested state and a relaxed state so that it gets ready for us to jump into that next strenuous exercise. Shorter intervals, 2 minutes or less, and really not doing the appropriate amount of rest has actually been shown to be quite detrimental to your muscles. It can impede the cardiovascular function. It can impede the metabolic function and put more stress on those muscles. It can also increase the amount of lactate that your muscles produce after exercise. And lactate can be harmful because, we all know because it produces pain. So we think, okay, our body probably is, shedding lactate after exercise, but it actually impedes a lot of other functions that we don't necessarily feel, and that can be dangerous too. And you might feel more tired than you should. Say you did a couple reps of some bicep curls and you don't think you did a lot, but you didn't rest enough between them, so your body is extra tired and you don't understand why, and that might be why. Now, reducing that time also has psychological effects because, like you said, mind also. So body, yes, you want the body to rest, but you need your mind to rest as well. The American College of Sports Medicine really emphasizes optimizing your sleep and psychological readiness as a part of your fitness to really optimize your endurance and to get you to that next level of exercise that you want to get to. And like I said earlier, more research is really needed for us to get some definitive recommendations when it comes to this, but we do know that hydration, nutrition, mental rest is all all very important, not only to improve endurance, but to reduce your risk of injury. Now, when we get impatient and we go from exercise to exercise and don't allow our muscles to stretch or rest properly, we are putting them under a lot of stress, and that increases the risk that they're going to spasm, that they're going to strain, that they may tear even. You might have a tendon tear. So really want to focus on the appropriate amount of stress. Now, you asked about supplements. This is a fun topic always. You want to focus on supplements, foods, and beverages that help with muscle repair, hydration, and rapid glycogen reintroduction into the system, because you want to replenish those muscles' energy reserves. When you're working out, you're using a lot of that glycogen. So when you're done, your body's like, oh, I need some more. And that's when you replenish it. Now, the American College of Sports Medicine has some recommendations, general recommendations on how you should do this. After about 30 or within 30 minutes of your last exercise, so you worked out for 45 minutes and you're done. After you finish, within that immediate 30-minute interval, what you should be doing is intaking carbohydrates at about 1 to 1.5 grams per kilogram of your body weight. When it comes to protein, you want to make sure you're taking in 10 to 20 grams of protein in that 30 minutes after you finish exercising. Now, you want to do this with healthy carbs. So no baked potatoes with cheese and bacon and onions, as good as that might be. You want to do some healthy carbohydrates and not refined sugars or refined starches. When it comes to protein, you want lean cuts of healthy meats. If you're somebody who doesn't like meat, then there's pea protein. There's other types of plant-based proteins that you can certainly look into as well. Now, for the fun stuff, supplements in particular. So you want to focus, like I mentioned, on foods that are anti-inflammatory and have a lot of antioxidants in them. And still, we need a lot of research in order to figure out exact definitions and exact doses and exact recommendations. But we have seen that tart cherry juice and omega-3 fatty acids, which I know many of us are familiar with because they have such good properties, these two items have been proven to reduce inflammation and reduce that soreness that we feel after exercise. So something to consider. Also, curcumin, the active compound of turmeric, has shown really good benefits as well, but again, more research needs to be done in that aspect. Now, when it comes to creatine, I know that's sometimes a magic word that's really talked about a lot across social media and among friend circles, especially when you start working out. Creatine monohydrate and L-carnitine may support muscle repair and reduce fatigue. But again, more research is really needed to know how exactly this works and how beneficial is it for the individual when it comes to recovery and exercise in general. Probiotics. Now, probiotics, you might think, why probiotics? What does that have to do with muscle building and exercise? Probiotics help maintain a healthy gut, right? So we've talked about before how a gut can be make or break you. Honestly, your gut can make or break you, your gut microbiome. And probiotics certainly help with your gut microbiome, therefore helping maintain a good immune system, and that keeps you healthy overall. Remember, all of this is influenced by your age, your underlying health conditions, your endurance level, and your fitness goals. If you're somebody who's in their 60s or 70s and you're getting into exercise now and you haven't really ever exercised, you don't want to go from 0 to 100 and start bench pressing 200 pounds. I mean, if you can, more power to you, but you're not going to get there right away. As opposed to somebody, say, in their 20s or 30s who's going into bodybuilding or something really strenuous. Your recommendations, either of those individuals' recommendations, are going to be very, very different. So please talk to your primary care physician, and you could also consult with a fitness professional to really develop a plan for you, a plan of action to get into a regular and healthy exercise routine and to avoid injury, because that's one of the things I want to emphasize more than anything is you want to do what you need to do to be healthy, but also limit your risk of injuries. And hopefully that'll help. Thank you again for your question. Let's move on to the next one. This comes to us from Leroy, and Leroy is watching YouTube. Thank you, Leroy. And he says, I wanted to ask about skin issues. My son's acne has gotten really bad. I thought it was from stress, but could it be related to gut health? He's a typical teenager with a very bad diet. What can we do to help him? This is also another really, really good question. And honestly, it hits home. I have acne and I have rosacea, and It definitely is affected by the things that I eat and how healthy my gut is that day or that week or that month. So you hit the nail on the head with this question. While there's still a lot of research that needs to be done, like with everything else in medicine, right? We do know that there's certain strains of bacteria, certain inflammatory foods that do contribute to acne and to rosacea and to other inflammatory skin conditions. For instance, the bacteria called Bifidobacterium and Lactobacillus actually help protect the skin. And studies have shown that individuals with severe acne, not just 1 or 2 lesions, but with really severe acne, have low levels of these good bacteria in their gut. So is that a direct relationship, or is that something that's just a happenstance? We're still trying to figure that out, but this for sure has been seen. So when you have good bacteria, you also have bad bacteria, right? And some of those bad bacteria that promote the development of acne are proteobacteria and Bacteroides. I know these names might sound like, oh my God, what is this stuff? But if you look at probiotics and you start looking into prebiotics as well, sometimes you'll see these names and it may be confusing, but the main point to know is that there's good probiotics and bacteria and bad probiotics and bad bacteria. Well, actually, there's no bad probiotics, but there's bad bacteria. And these can all certainly affect the development of acne. And with other diseases and a lot of other health conditions, the inflammation, the levels of inflammation in your gut that's influenced by the gut microbiome really affect how much skin disease, skin inflammation a person is going to have. And certainly it can contribute to acne and to rosacea. But this has really only been seen in studies as a potential relationship. Like I said, we need more research to find out, is this really a direct cause? Either way, what we do know is bad gut microbiome, inflammation, acne. So if you want to eat things that are anti-inflammatory, high in antioxidants, and avoid processed foods or avoid foods that are going to cause more inflammation and damage to the gut. At the same time, exercise. You also want to make sure you're getting regular exercise, or that he's getting regular exercise. I think one of the things that we typically do as young individuals when we're in our teens and 20s is we eat anything and everything. I kind of miss those days. And you really aren't affected by much. But as we grow older, those same things and same habits are going to have detrimental health effects. So maybe talking to him and saying, hey, let's talk about changing around your diet a little bit. And let him know why, because that really motivates people. When you tell anybody that they need to do something, it's also important to let them know why they need to do it and why it's important for their health. And I think if you do that and he understands, he's probably going to want to change the way he's eating and doing things. And hopefully that'll result in an improvement in his acne. Now, if his acne is quite severe and just changing diet or exercising more, hydrating more, implementing these lifestyle measures isn't enough, then I really recommend seeing his primary care physician or a dermatologist even to really figure out what needs to be done. Unfortunately, conditions like acne and rosacea are kind of like holding sand in the palm of your hand. You're never really going to grab it all, and it's very difficult to hold it. So just like that, treating these conditions can be a lot sometimes. It's not just a clear-cut, easy answer. But the point is, if you do it with a professional, you're going to have the best chance of treating and managing those conditions, and then avoiding future breakouts as well. I hope that helps answer your question. All right, these are some great questions, and we still have some time for some more, but I know you probably want to send some in to me, right? Here's how you can do that.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
All right, let's keep it going. Our next question comes to us from Susan, and Susan writes in asking, not to sound gross or get too personal, but I have been constipated for the past week. What causes constipation? Or on the other hand, what causes diarrhea? Hi, Susan. Thank you for sending in this question. And I also appreciate you sending it in, even if you feel like it might be too personal. For us physicians, really nothing is too personal. So I'm glad you sent it in. So let's talk about it. Now, when it comes to constipation and diarrhea, it may seem like that these are conditions or symptoms that are related to a couple specific issues. And when somebody has them, we can say, oh, that's what you have. Unfortunately, constipation and or diarrhea can be related to a variety of conditions, not only stomach conditions, but also conditions outside of the GI tract. For instance, when individuals get a little bit nervous or have some anxiety or even have a panic attack, that can induce the production of diarrhea. On the other hand, diarrhea can also be a sign of a GI infection or other inflammatory diseases like inflammatory bowel disease or even irritable bowel syndrome. And also, something more sinister sometimes, cancer can also cause diarrhea and constipation, although we do see constipation with it more often. But the most important thing that I want you to know is that anytime you experience these symptoms, whether it's diarrhea or whether it's constipation, if it occurs for more than 1 or 2 episodes or lasts for more than 1 or 2 days, you should really get it checked out, because then you want to know, what is it in my body that's causing this to happen? Sometimes it might be something as simple as something you ate. Maybe you ate something that just didn't agree with your stomach or caused some heartburn, and that worked its way down and now is causing diarrhea. That happens a lot. But unfortunately, sometimes it might be the sign or the clue that something more sinister is happening in the GI tract. So you really want to get on it as soon as possible and not really delay it. And it's important because, like I said, there's so many diseases that have diarrhea and or constipation as one of their main symptoms. So please reach out to your primary care physician, and I hope you get the answers and I hope you feel better. All right, let's get to our next question. This one comes to us from John, and John asks, I love eating carbs, from bread to pasta and everything in between. You and me both, John. Lately, my wife is trying to get me to eat whole grains and wheat instead of white starches. Is there any scientific evidence that shows white starches are bad for you? Please tell me she's wrong. Okay, John, unfortunately for you and for she is not wrong. And allow me to explain how these foods and these items can negatively impact your GI tract. The main method is, when you're eating these types of unhealthy foods, you're probably not getting the nutrients that you need to get. You're not getting the ever so essential fiber that you need to be getting. And if that's happening, then that's promoting a bad gut environment, a bad gut microbiome, and not obviously, but as I've mentioned throughout this episode, that can be very, very bad. Now, as you know, fiber is very, very important when it comes to our gut health, and it's important for a lot of our body's internal mechanisms as well. Also, these types of food, especially if they're processed white starches and white grains, they can actually make more inflammation in the gut, which is certainly unhealthy. And it's okay to consume these from time to time, but I do recommend avoiding them as much as possible and replacing them with healthy starches and with healthy carbs. So instead of eating a white potato, eat a sweet potato or a purple potato. And instead of eating bread that is just regular white bread, maybe switching to something that's whole grain, or even making bread at home yourself, which has less preservatives and less of the inflammatory stuff in it. So things to consider. All right, let's get to our next question. And this one comes to us from Jessica. And Jessica writes, this is a piggyback question from our last one. How important are fiber and fermented foods to help with gut health? My doctor wants me to take more fiber to help with my stomach issues, but I'm not sure that will help. Great question. We always talk about fiber and fermented foods being important, but why? One of the most important things that these substances do is help grow good bacteria in our gut. And then those bacteria in turn produce substances that further promote the health of our gut and our overall system by being anti-inflammatory and by promoting a healthy and strong immune system. Depending on what stomach symptoms you're experiencing, it may take some time to change over your gut microbiome to a very healthy one, but it definitely will help with your symptoms for the most part. Now, I always want to put a disclaimer on that, because depending on the symptoms that you're having and the exact cause of those symptoms, sometimes creating a healthy gut microbiome isn't the only answer. It might be majority of the answer, but not the only answer. We do want to do what we can primarily to lower the inflammation in the gut, because we know that that causes a whole heap of symptoms. Now, when it comes to creating a healthy gut microbiome, I've mentioned, fiber helps, fermented foods help, some supplements might help, exercise helps, sleep helps, all this stuff helps. But it's important to know that you can't go from a unhealthy gut microbiome to a healthy one in just a couple days. This is a process that you should anticipate will take about 3 to 6 months, sometimes even longer, because think about it. With all that's going on in your gut and in your stomach and all those little microorganisms, I mean, there's hundreds of thousands, if not millions of them. And for them to turn over from bad to good is a very slow process, and it needs to be done in a very regimented manner. Sure, you could wake up tomorrow and start eating a lot of kimchi and sauerkraut and things that have a lot of fiber in them, but that might also be detrimental sometimes too, because you're introducing all these new things into your gut, and your gut's like, wait, what's going on? I can't handle this. And then that in turn might produce some of those same GI symptoms that you're having to begin with. So anything that you want to do when it comes to your gut microbiome and changing it, you want to do it slowly. And as always, you want to do it in consultation with your primary care physician or your gastroenterologist, because you want to do it in a healthy way, right? Thank you again for your question. This has been a great episode. I love all these questions about gut health and what we can do to prevent diseases like diabetes. And you know what? I really, really enjoyed this time. I hope you did too. I hope you learned a lot as well. As always, your questions are most welcome, so please keep sending them in and we'll try our best to get to them. Again, my name is Dr. Kamaljit Kaur, and it's been a pleasure.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.